Chronic fatigue is by far the most common symptom patients present with in office today, but very rarely does someone ever come in with just fatigue as their only complaint. It's almost always associated with other conditions or concerns. Fatigue is often a metabolic burnout state of these other conditions and concerns, and inflammation is by far the most common condition contributing to fatigue. We almost never see a chronic inflammatory problem that doesn't have fatigue associated with it. So what's the connection between fatigue and inflammation, and how does inflammation lead to fatigue? That's what we're going to try and answer in this video. In the medical textbooks and manuals, there are literally thousands of conditions that can have fatigue as part of their symptom picture. But when we have fatigue and we try and look for ways to treat it, we tend to address it from a singular point of view. And we want to know what one thing is causing it and what one thing can cure it. So we go to Dr. Google and YouTube and we look for what causes fatigue and how can we treat fatigue. And we'll end up with an endless list of websites and videos, all suggesting that they have the answer for your fatigue state and the miracle cure or diet or supplement or treatment for your fatigue. And as many of you know, if you've tried any of these programs, they often fail to deliver on the promises they make. And the reason for this is very simple. Each person's fatigue state is caused by multiple factors, and each person's causative factors are completely different. There's not just one thing that causes fatigue in everyone that has it. Now, both practitioners and patients alike recognize that psychological stress can play a major role in a person's fatigue state. But there are people out there who have exorbitant stresses in their lives, and they don't have fatigue, and there's other people who have minimal to no stress in their lives, and they have terrible fatigue. So psychological stress can be a major contributing factor to a person's fatigue state, but in many cases, it's not the major or even the biggest contributing factor to the fatigue state. Stress can be equally physiological as it is psychological, and it's this distinction between physiological or psychological stress that can actually connect the dots between inflammation and fatigue. So what are some examples of physiological stress? Well, think of menstrual cycles in a woman. Twice a month, their estrogen and progesterone go up and down. The liver, kidneys, and bowels have to physically clean this hormone up. We don't have to convince any of the moms out there how big a physiological stress on a woman's body a pregnancy or lactation is. Infections, colds, and flus are major immunological stresses on the body. Medications create detoxification stresses on the body. And inflammation is a key and critical physiological stress on the human body. It's by thinking of inflammation as a physiological stress on the body that we can begin to understand how it relates to both fatigue and our abilities to cope with psychological stress. Now, when we look at this diagram of all these different factors that can affect fatigue in our bodies, there's one thing that can tie many of these things together, and it's inflammation. When we think of medication side effects, inflammation is what leads to a lot of those medications being given in the first place. Autoimmune disorders are inflammatory by definition. Chronic infections will lead to an inflammation of the tissue affected by the infection. Hormone imbalances, neurotransmitter deficiencies, and adrenal insufficiency, these are all hormone systems which our bodies use to go and combat inflammation when it finds it in the body. Thyroid disorders can be inflammatory. Autoimmune conditions like Hashimoto's and Graves' disease. Nutrient deficiencies can be caused by inflammation. A simple example of that would be gastritis or inflammation of the stomach lining. That can lead to a drop in hydrochloric acid and other enzyme production in the stomach, which we need to digest and break down and absorb certain nutrients in our diet. The gastritis can also lead to indigestion, heartburn, and reflux troubles, which can then lead to medications to treat the reflux. And they work by cutting down stomach acid production, which we need to absorb these nutrients. Chronic pain conditions are often inflammatory. Sleep conditions are often inflammatory. So when you look at your fatigue state and you look at these other factors that I've listed here, there's a really good chance you're going to find some of these as being part of your overall symptom picture. So hopefully you can now see why there's not really a good one-size-fits-all supplement or diet approach to treat fatigue in everyone that has it. Everyone will have a completely different set of factors contributing to their overall fatigue state. And everyone's inflammatory triggers for their body contributing to those factors will be completely different. Now, how often have you heard the term, it's just stress, with relation to any of your health concerns? When we have blood tests done, x-rays, physical exams, and nothing comes back and explains why we're feeling the way we're feeling, quite often it just gets blamed on stress. It's a bit of a catch-all term used to describe what we can't describe in other terms, basically. Now, I'm not suggesting psychological stress can't have really serious negative impacts on our health. It can. What I'm suggesting is that it tends to get blamed for some things which it shouldn't be blamed for. And inflammation is one of these things. Stress actually can't trigger inflammation. Now, that sounds like a little bit of a controversial statement, but let me explain. The immune system is a mechanically driven system. It's run by a lock and key mechanism. There are cells called white blood cells which go through the body looking for foreign invaders, bugs, bacteria, viruses, cancer, anything that's not supposed to be in the body. These white blood cells have receptors on them. They're like little arms with feelers on the end. And it's these little feelers that bounce into things in the body and touch them, and they determine if they're allowed in the body by how they feel and by their structure. Now, in nature, there's an infinite times infinite number of possible allergens and antigens. It's based off the three-dimensional protein structures and amino acid structures. So it's not like we have one receptor for one type of bug, another receptor for another type of bug. There are literally an infinite number of possible three-dimensional arrangements. It's kind of like a company who makes keys and door locks. They can make one basic key structure that can fit into any of their locks, but only one key will turn each individual lock. The white blood cell receptor and antigen response is very similar to this. When the white blood cell finds something in the body that's not supposed to be there, the receptors will grab onto it. The antigen fits into the receptor like a lock and a key. And this receptor activation, this receptor binding, is what initiates most of the inflammatory cascades and processes that lead to inflammation. Now, there's many, many different types of inflammatory processes that can happen after this activation of the receptor. But the key point here is the receptor has to be activated. You have to put the key in the lock to turn on the inflammation response. Now, to say that stress can actually trigger or cause inflammation, you're basically implying that the receptor on the white blood cell could bind to a stressful thought in your head. And is that possible? No, it's not. Now, stress can fan a fire, it can feed a fire, it can make a fire worse, but it can't actually light the fire. The immune system is very, very reliable, and there is always a trigger for this activation and inflammatory cascade. That's the key to figuring out these inflammatory problems. So how does stress impact inflammation levels and ultimately fatigue levels? It's actually through a body system called the adrenal gland system. These are two little glands that sit on top of the kidneys. They look like a sponge sitting on top of the kidney, and they drip adrenaline into the bloodstream all day, every day. Now, adrenaline comes in many different forms. There's epinephrine, norepinephrine, cortisol, aldosterone, DHEA. Actually, estrogen, progesterone, testosterone are forms of adrenaline as well. We have many different forms of adrenaline because we have many different types of stress that we need adrenaline to suppress. Adrenaline essentially is stress-suppressing hormone. Now, a key point to make here is when you think of estrogen, progesterone, testosterone, we know those fall as we get older. Women go through menopause, men go through andropause. So those are three steroid-based forms of adrenaline that fall as we get older. But it's not just those hormones that fall as we get older. Cortisol falls, epinephrine falls, aldosterone falls. And these hormones aren't sex hormones like the estrogen, progesterone, testosterone. A lot of these are anti-inflammatory hormones. What this means is as we get older, our body's ability to keep inflammation at bay and keep it suppressed weakens because a lot of our body's hormone systems to fight that inflammation weaken as well. This is a key concept we're going to talk about in a few minutes here. So we've already talked about psychological stress and physiological stress. Psychological meaning relationships, bills, finances, and those types of things. And physiological stresses, inflammation, which is a key one, but also hormone balances, detoxification, things like that. And we have different forms of adrenaline to deal with both types of stress. But we're just going to kind of classify them all as adrenaline. And a key one we're going to focus on here is cortisol. Another way I like to describe stress is it's like little volcanoes constantly trying to erupt in our body. We have a little volcano for our spouses and partners. We have one for our kids. We have one for our work. We have one for bills. These would be little psychological volcanoes. Then we have physiological ones, menstrual cycles in women, colds and flus, metabolic stress, cardiac stress. So at any one point in your daily lives, we have a dozen little volcanoes erupting over here psychologically, and we have another dozen over here erupting physiologically. And when we're young and healthy, when we have lots of adrenaline, it can keep all these different little volcanoes in check. It can put caps on the volcanoes. Now imagine a situation where you get in an argument with a loved one or an acute stressful situation at work. What can happen? This little psychological volcano can erupt a little bit. Now, you have to keep it together. You have to keep calm, cool, and collected. You have to go about your life and do your chores and everything else to appear normal. The way you do that, your adrenal glands come over here and they pump out extra adrenaline to put a cap on that excess psychological stress. And when you're young and healthy, you have lots of adrenaline to do that, so it shouldn't impact you over here from an inflammation point of view. But let's imagine we have a stress that doesn't just happen for an hour or two, but goes on for a day or two. This little volcano erupts like crazy. The adrenal glands have to come over here. It's basically what we call a fight or flight response to put the cap on that little psychological volcano. And if it goes on for too long, and if it happens when we get older and we have less adrenaline to deal with it, it can actually start to steal adrenaline from this little inflammatory volcano over here. And what happens here, your inflammation levels will rise. And what you'll notice is during high periods of psychological stress, my inflammation is worse. And therefore, it's easy to say, well, the stress caused the inflammation. But it didn't. What the stress did is it pulled your anti-inflammatory systems away from the inflammation. It robbed Peter to pay Paul. Now, you can imagine, let's imagine it's not a psychological stress that goes on for a few hours or for a few days. But if we get in an unhealthy work situation, or if we have an unhealthy or abusive relationship that goes on for months or years, You can see the impact on the adrenal glands that this would have, and you can see the impact on our inflammatory processes over here. But this works in reverse as well. We can have an inflammatory little volcano erupt over here, a cold or a flu or an infection, and our adrenal glands will have to come over here to fight that. The fight or flight response comes over here to the physiological stress. This can allow the psychological stresses to erupt a little bit. So mountains out of molehills, edgy and irritable, things we shouldn't be edgy and irritable about. Now, if that inflammatory stress goes on for a very short period of time and it settles down once the cold or infection goes away, your adrenal glands can sort of recover fairly quickly and then we appear normal again. But what happens if we have a chronic physiological stress? If we have an inflammatory problem, skin problem, asthma problem, constipation or stomach or reflux problem, and this little inflammatory volcano goes off and never stops going off, well, it's like your adrenal glands are out in fight or flight mode to deal with that inflammatory stress, not just for days or weeks, sometimes months and years. That will drain this adrenal system, and this can actually contribute to the psychological stress being worse than normal. This can create an anxiety picture, which is caused because of a lack of adrenaline to cope with those psychological stresses. So the adrenal glands sit in the middle here, and they manage both. And as we get older, as we get into our 40s and 50s, we have less adrenaline to do all these jobs. So we can either fight inflammation or we can fight psychological stress. But sometimes we don't have enough to do both well. And this is where these problems can happen. Now, unfortunately, we don't have diets and vitamins and supplements to deal with a lot of these psychological issues in our lives. There's no diet or vitamin or pill that will make a work situation healthier for us or fix a relationship we may have. So if we're going to look at these stresses that we can manipulate to ease the strain on the adrenal glands, the inflammatory one is the most important one, because if we can identify that inflammatory trigger, we can actually turn off that physiological stress volcano and allow more of our cortisol that we have available to go over and deal with the psychological stress. Now let's talk more about fight or flight. Most of us have heard this term. Fight or flight is essentially our body's 911 system. It's our emergency services. And what it is, it's a sympathetic nervous system response that activates your adrenal glands to help you get through a crisis. An example I like to use here, imagine walking down a path in the woods and a bear jumps out in front of you. Well, if you don't either fight that bear and kill it or flee from the bear, you're probably not going to survive. So your sympathetic nervous system kicks in, it goes to that little adrenal gland, that little sponge I talked about, and it wrings it out. You get a big gush of adrenaline into your bloodstream. This adrenaline, it increases your heart rate, it dilates your pupils, it increases your breathing rate. It shuns blood from your internal organs to your heart, your muscles and things so you can fight or flee from the bear. It's a physiological response to enable you to cope with that acute stress. Another example would be you're driving down the road and a car turns out in front of you. Well, you get this instant surge of adrenaline so you can steer the car away and avoid that impact with the other car. And it's a surge of adrenaline that creates a physiological changes in the body that allows you to react so quickly. Another example could be a superhuman strength story we may hear about. Someone gets in a car accident, the door is jammed, there's a baby inside, and they go over and they rip the door off the car. It's the adrenaline surge that goes and creates this type of environment in the body that allows us to do these types of things. Now, we can go into fight or flight, high adrenaline mode, not just when a bear jumps out in front of us or we almost get in a car accident, but we can get into that mode during just low-grade, normal, stressful events in our lives. Imagine waking up in the morning. You have to get the kids up, get them fed, get them dressed, get them off to school. And in the midst of that, you have to get dressed and ready for work. You go to work, you've got a big project due. In the middle of the day, you have a doctor's appointment. After the doctor's appointment, you have to go home and pick up the kids, make supper, clean the kids up, get them to bed, then do laundry, et cetera, et cetera, et cetera. So our sympathetic nervous system can kick in and wring that sponge out just to get us through normal daily stresses. When we're young and healthy, we have lots of adrenaline in our adrenal glands. We don't need that extra kick in the morning to get us going. But when we get into our 30s and 40s and we start to wane from an adrenal function point of view, that's where our nervous system has to kick in and create that extra little surge for us. Now, in that scenario, we have high adrenaline in the first part of the day. And then when the kids are in bed, you sit on the sofa, you take a deep breath and you go, you turn off the sympathetic fight or flight system. This is where we get into crash mode. That's basically crash and recovery mode. So we go from high artificially increased adrenaline output through the day to no adrenaline at the end of the day. And that's when we're supposed to go to bed and recover. So this could be a typical stressful day for someone in their 30s or early 40s. But let's imagine a situation where the stress isn't just throughout the whole day, but it may go on for a few days to a week or two. You have a big project at work and we're not getting along with our coworkers. Well, that little knot in the stomach, that little fight or flight response, it can actually go into this high crisis mode and not settle down for a period of days as opposed to just within that day we talked about before. So the longer this acute crisis stage goes on, the longer the crash and recovery phase is going to be. Imagine a situation with a bad relationship or an abusive relationship that can go on for months or years even. It's like you're living in fight or flight state constantly, and it never has a chance to turn down. Now, when that situation resolves itself, then we go into this crash mode that just seems to go on perpetually with no end in sight. Another way this presents is people will tend to live in fight or flight mode and then crash and exhaustion mode, fight or flight mode, crash and exhaustion mode. It just repeats itself. So it's either they're excited and anxious and go, 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 and then they've got nothing left in the tank. That describes a lot of people with chronic fatigue. And it's very indicative of this high fight or flight mode and crash mode. So in this scenario, the way to affect this is we have to look at what's creating this fight or flight mode. So imagine we have a situation where we have psychological stresses creating a crisis fight or flight state. But on top of that, you also have some inflammatory issues going on. It can take that rise in the fight or flight state and make it 10 times worse. Now in that scenario, sometimes there's not much we can do about the psychological stresses, but we can work with that inflammatory one. So we might be able to take you from here down to here. We have to pick on the stresses that we can actually pick on and manipulate. And inflammation can be one of those stresses. So this diagram might make things a little bit easier for us. Now, if you've seen any of the videos on the channel here, you're going to recognize that food sensitivities and food allergies can actually be a major contributing factor to inflammation in the body. And we have to talk about inflammation as well. Most people think of inflammation as just muscle and joint aches and pains, but inflammation is much broader than that. Inflammation can present in the GI tract. Gastritis in the stomach is by definition an inflamed stomach lining, and that can lead to heartburn. You're treating it with a reflux medication, but the inflammation process is still there. We have a video on constipation showing it as an inflammatory problem. And I see lots of people who say they're constipated right from childhood. Imagine how long that stress goes on, that physiological fight or flight state. Lung issues like asthma or bronchitis. Asthma, people can have that their whole lives. And again, another chronic inflammatory state. Chronic infections, vascular problems with chronic migraines and headaches. You might say, well, how is that inflammatory? Well, if you've ever taken an anti-inflammatory medication and if it's helped with the symptom, that's an easy way to determine if it's an inflammatory symptom. Nerve issues with neuropathies, organ and gland issues, seasonal allergies can be long-term chronic inflammatory states that can go on for weeks and months and year after year. So again, a chronic long-term physiological stress in the body. So considering these types of inflammations now, inflammation puts a strain on the immune system. The immune system's main job is to kill bugs and bacteria and viruses. These things can kill you. So the immune system has to be primed and ready to go to fight those types of foreign invaders to the body. The body system that replenishes the immune system is the adrenal gland system. It doesn't through a few different mechanisms and a few different hormones, but basically it supports adrenal function. The other thing the adrenal glands do is they produce cortisol, which we've already talked about. Cortisol is an anti-inflammatory. So if you have a chronic inflammatory problem going on in the body, your adrenal glands will pump out cortisol on a very regular basis to go and fight that. It's like it's under fire call for the whole time frame that you have that inflammatory problem. You can see the impact that these are going to have on the adrenal glands. It's going to suppress them. It's going to weaken them. This can create a state called adrenal fatigue, adrenal exhaustion, and adrenal burnout. The symptoms here would be fatigue and exhaustion, lack of endurance, poor focus, concentration, and brain fog, anxiety oversensitivity, edgy and irritable, a drop in motivation and inertia, get up and go. Sleep issues, trouble getting to sleep, staying asleep, waking up, not getting back to sleep, or waking up unrefreshed regardless of how much you sleep. Salt, sugar, and caffeine cravings, ringing in the ears or tinnitus, metabolic issues with weight and thyroid and hormone balances, high and low blood pressure. Quite often it's low with adrenal issues, but it can also be high. A decreased libido, reactive blood sugars, depression. Now, if we look at this list and you have any sort of fatigue state going on at all, you're going to likely recognize some of these other issues here. This supports the idea that the adrenal glands may be a source of the fatigue or at least a significant part of the fatigue puzzle. Now, another consideration here would be menopause and andropause. These are naturally pre-programmed declines in hormone output. And again, it's not just sex hormone, it's all these hormones. We have less available in our 50s and 60s than we did in our 20s or 30s. Psychological stress. There's no question that this has a detrimental effect on the adrenal glands and our ability to cope with other stresses. Now, from a treatment point of view, when we look at this list here, with muscle and joint issues, we tend to take anti-inflammatory medications for it. With stomach and bowel issues, laxatives, stool softeners, motility drugs, reflux medications for the stomach. Lungs, we use puffers for asthma, NSAIDs for headaches and migraines, antibiotics for colds and flus, et cetera, et cetera. Now, sometimes we need these medications to manage these symptoms. I'm not suggesting otherwise. But if there's an inflammatory mechanism behind those, and if we can get rid of that inflammation process, we're going to see benefits in many other ways. The treatments down here for fatigue, exhaustion, focus, concentration, that's a very typical ADD or ADHD picture. And what's the medication they use for that? Methylphenidate are basically forms of stimulants or forms of adrenaline. Now, this makes sense if you don't have enough adrenaline being produced on your own. If you take an outside source of adrenaline, it should help with the symptoms caused by the adrenal deficiency. And this is a classic example of ADD and ADHD being related to adrenal output, because those stimulant-based medications tend to help with those symptoms. We'll take blood pressure medications for blood pressure issues. We'll take anxiety medications for anxiety and depression. So the treatments that we're talking about here manage basically the symptoms of the inflammation and the adrenal fatigue. If we can identify that source of the inflammation, and if that is part of the puzzle here, you can see the potential benefits that we're going to get in many other ways. So we've talked about inflammation and adrenal function, and a lot of this is probably going to resonate with some of you. And you're going to think, okay, well, there might be an easy way to treat this. Why don't I just treat the inflammation with anti-inflammatories? And there's some reasons why that won't work. So we get exposed to an antigen or an allergen from a food or an infectious agent point of view. The immune system will go and interact with that. And the interactions here are endlessly complex. We won't get into them in this video, but basically white blood cells interact with the antigen. It can incorporate B cells in here, and it starts producing antibodies and cytokines, all kinds of different immunological components to go and create the inflammation to target what it was created against. This creates the inflammation cascade we talked about before. Now, the concept here is, why don't we just treat the inflammation with anti-inflammatory therapy? The problem with that is it addresses the inflammation symptom, but it doesn't address this process up here that led to the inflammation. So we can take an anti-inflammatory for an inflammation symptom caused by either a food or an infection. But unless we get rid of the food and the infection, this immune process will still go on. The anti-inflammatory doesn't take that process away. So we may see symptomatic improvement with the physical symptom caused by the inflammation, but quite often we're not going to see the subjective symptoms improve related to this adrenal fatigue state over here. So again, some people will target the inflammation in this whole process, and you can see why that may not work now. Another aspect here would be, well, if it's draining the adrenal glands, I'll just do adrenal support to fix the weakened adrenal system. The problem with that is if you don't address the inflammation, whatever you do to rebuild the adrenal system isn't going to work as well. Imagine the adrenal system as a big bucket. Your adrenal glands is a big bucket. It's filled with adrenaline. As we get older and our bucket naturally empties, just with life and age, if we have a bunch of holes on the bottom of the bucket, an inflammatory hole, a psychological stress hole, a work hole, etc., we can take adrenal supplements and things to fill that bucket back up again. But if we don't address the holes on the bottom of the bucket, whatever we take to pour in on top of the bucket is going to go right out through the bottom. Now, some of the holes in the bottom of the bucket aren't negotiable. Age isn't negotiable. We can't take someone who's 61 and make them 21 again, so we can't fill it up naturally like that. Sometimes we can't alter our workplace. We can't alter our relationship situations. So some of these holes aren't negotiable, but the inflammatory hole is often one that we can manipulate. If we can identify that trigger and get rid of it, that's a big hole that we can plug. So if we plug that inflammatory hole and we take adrenal support after that, it's going to work much more effectively to build that adrenal gland back up again, and we won't have to do it as long. Another issue with adrenal support is adrenal fatigue and adrenal exhaustion is not just one condition or one state. It's not something you get tested for at the doctor's office. It's kind of a subjective diagnosis. But also there's different phases of adrenal issues. There's the acute crisis state we talked about, and then there's the crash state. So if we go look for adrenal support, which some of you probably will do after this video, you'll find a lot of supplements that have a lot of the same ingredients, B vitamins, vitamin C, magnesium, herbs like ashwagandha, astragalus, and these sorts of things. But some of them will have herbs in them like ginsengs, licorice root extracts. These herbs tend to have a little bit of a stimulatory effect. Now, the problem with this is if you're in the acute crisis phase right here, and we take something to stimulate adrenal output, it can actually take this little peak and raise it up. So if we're in this crisis mode, high adrenaline mode, and we do that form of adrenal support, it can actually make that state a little bit worse. Now, if we do that type of treatment and we're in the crash phase here, it can actually work a little bit better. And many of these herbs are considered what are called adaptogens, that they can adapt to what your body needs. If it needs stimulating, it will stimulate it. If it needs calming down, it'll calm it down. But in practice, I've only ever really seen these types of herbs stimulate in the short term. They're kind of like healthier herbal forms of caffeine. They increase output from the adrenal glands. Now, another issue with this, if our adrenal glands have been overworking and over-secreting, and we get into this crash mode here, we can create a temporary increased output from the adrenal gland, either the use of caffeine and coffee, things like that, or we can use these herbs to do the same thing. The problem is if we artificially stimulate or wring out that sponge to get a boost of adrenaline because we don't have enough adrenaline, when we let go of that sponge, what's going to come out of it? We're going to have too little again, and we're going to need more of it the next day. So adrenal supportive supplements are not all created equal. We have to have a good understanding of what phase of adrenal dysfunction we're in before we can treat it appropriately. There are herbs and supplements which are very effective at calming down the fight or flight state, And then there's other supplements which are very good at tonifying and rebuilding this adrenal gland. But again, a key concept here before we get to do those things is we have to identify the holes in the bottom of the bucket that are draining the adrenal gland. And quite often, this is the inflammation piece of the puzzle. There's several other videos on here, one on reflux, one on constipation, one on IBS, that touch on this inflammatory process and how food can trigger it. If you've seen any of the videos on this channel, you're going to recognize and see that food can have a major impact on this. The combination of food sensitivities and food allergies. Now, if you found any of the information here helpful or any of the other videos helpful, please subscribe and share this with friends and family. We all tend to have these food issues, and quite often there's a genetic component to them. Also, if there's another food and inflammation topic you'd like addressed with a video on this channel, please leave a comment below. Thanks, and we'll see you in the next video.